Well, hi everyone, it's Pete here from the Pain Toolkit, and welcome back to another Pain Toolkit video or recording in conversation with Pete. And I'm really lucky. Guess who I've got today? I've got Andrea Furlan from all the way over there in Ontario, in the delicious Canada. I'll tell Andrea, it's one of my places I've still got to visit. But I know it's your morning, but yeah, well, good morning to you. It's good afternoon for me. But how are you today?
Very good. Thank you, Pete. Yeah, it's morning here.
Yeah.
It's a snowy day. We had a lot of snow here in Toronto, Canada. It's cold, but it's a pleasure talking to you and start my day with a great talk with the famous Pete Moore.
Not famous. Hey,
You are
talk
so
about
great.
talk.
I really admire you.
Hey,
Yes.
listen, talk about being famous. You have got loads of. I mean, the amount of videos you do, and you've got a lot of fans out there, And I do. People say to me, "Oh, do you know Andrea?" I say, "Yeah." I say, "Who doesn't?" But Andrea, can you tell the viewers and listeners, what you actually do over there in Ontario?
Yes, I am a physiatrist, a specialist in physical medicine rehabilitation, and I work in a pain clinic at the Toronto Rehabilitation Institute, which is one of the largest rehabilitation hospitals in North America. And in the pain clinic, I see patients with chronic pain mainly, and I help them to live a fulfilling life. As a rehabilitation doctor, we help them to, manage their pain, treat their pain, and they come from a lot of other clinics at the hospital.
Hmm.
So people who had accidents, strokes, amputations, spinal cord injury, but also people who have low back pain, fibromyalgia, muscle pains, and all kinds of chronic pain.
So maybe a bit of a stupid question, but I mean, I know pain is sort of. I mean, I've been doing this for 20 odd years now, 25, coming up to 30 years, and the amount of people living with pain, it ain't going down, it keeps going up and up. So,
Yeah.
but I've always, I think one thing I've always been impressed with Canada is that you seem to be in lots of areas very proactive in supported self management and stuff like that. I
Yeah.
mean, how big would you say supported self management is in Canada?
Yes, so fortunately, our government, because here in Canada, healthcare is embedded in the public health system, so everybody who lives in Canada has access to free healthcare. And so our government has been smart in the last couple of years because they bought a lot of self-management packages that are evidence-based, developed by people who know what they're doing, and they make this freely available to the common citizen. And so, for example, in Ontario, we have, and we, even before the pandemic, we had this online. So people had, they had the choice to attend in person or online. Of course, during the pandemic, everything was done online only, and now they're coming back to in person. So anywhere in Ontario, has access to self-management programs. It's a 6 weeks program, and they go, they attend, even they get paid their bus tickets to get there. They get a snack because those programs, they have to go and be there for 2-3 hours discussing. And it's not only for chronic pain, but they also have for cardiovascular diseases, for diabetes, and it's not only for people with the diseases, but also for the caregivers. They can, if a family member wants to learn more about a disease, they can register themselves. They don't need to be referred by a doctor and learn more about the disease and how to take care of themselves. The problem is that a lot of patients don't want to go, and a lot of people don't think that this is a good idea. So they, we still have a barrier and a lot of work to do here.
Yeah, I think it's the same here as well. A lot of people, as I was back in the day, you get locked into what I know as the medical model. Where
Yeah.
back then I was like a serial doctor shopper and therapy shopper,
Yeah, they
expecting
go
them.
from doctor to doctor to doctor. They
Yeah,
want injections, they want more MRIs, they want a magic solution. They don't want to take care of themselves.
and with self management, it's a doing thing, isn't it? It's not something. Well, I always say it's not like dear Arnold Schwarzenegger, I've read your book,
Yeah.
now send me the muscles.
Yeah.
You know,
Yeah.
something.
Passive. It's not
Yeah,
passive. It's very
no,
active.
yeah,
Yeah.
it's about doing. I mean, I've got a lot of people contact me most days, and they're always looking for that quick fix. Still, like, if unfortunately, there isn't a quick fix. It's something you have to be very proactive. But self management, it doesn't intrude too much on people. So it doesn't intrude on my life because, you know, um, it's become a habit now, like brushing my teeth.
Yeah.
I don't think about, oh, I've got to remind myself to do some stretching in the morning or
It's
yoga
like
or
brushing your teeth, right? Brushing your teeth is self-management, and
yeah,
you,
yeah, because it
yeah,
saves trips to the dentist. But listen, I know that I mean, you say you're quite prominent, I guess, on social media, especially. I follow you a lot on follow you on Instagram. I mean, I like that. I've really got into that in recent months, really, because I think it's good short messages, and
yeah,
a lot of people with pain are visual learners, I think. But I mean, what's the feedback been for all the social media work that you do?
yeah, yeah. I think social media is great. It takes a lot of time to do, as you know, but it's great as a communication tool. Because I can see if I was not on social media, my impact, I have 30 years of experience, Pete. I graduated from medical school 30 years ago. So I think I have a lot of knowledge and experience and expertise. And if I was not on social media or YouTube, I probably would not reach all the people that I was able to reach. And so it's a way of me to share what I know.
Mm.
And it was really exciting when I opened the YouTube channel in 2019 because I did that for my own patients. I started recording myself with my cell phone at home here in this room, and just to educate my patients, because I don't have a lot of time during my consults to educate them. But I said, go home and watch me explaining this on YouTube. And my patients really liked that. But I guess not only my patients watch my YouTube channel, because right now I have more than 44 million views on my channel. So it's a lot of people.
44 million views.
Views. Yeah, 500,000 subscribers, and my channel reached 44 million views.
Well done, fantastic. Oh, that's incredible. I didn't know it was that much.
It's a lot of views, yeah.
What do you think is the best format on social media? It's YouTube or Instagram or Twitter, Facebook? I mean, what do you think
Yeah,
is?
I think each person is different, Pete. I think each person has a personality that matches better a different type of social media. I tried Twitter for now, I think 13 years I am on Twitter. And I grew. I have about a little bit less than 6,000 followers, but I didn't grow so quickly on Twitter. And I'm also on Instagram, and I have about 5,000 followers, which is not considered big, but I never imagined that my YouTube channel would grow so big. So I think each person has a personality that matches better. My videos, the ones that are most popular, they are the longest videos. I have videos I have a lot of videos with more than 1 million views, and they are long, and I'm giving them a talk, I'm demonstrating exercises. So I think for me, YouTube worked best
Okay.
for me to relay my message. And then lately, last year, I decided to put all of my messages because once I have the YouTube channel, I had a lot of scripts and a lot of things, the videos that I prepared, and I said it's time to write a book. So I decided to contact a publisher and put all of this information that I have on YouTube in a book, because people have difficulty finding the right video on YouTube. YouTube is kind of disorganized.
Yeah, yeah.
So I like to
What's your
share
book?
with your
You got your
audience.
book
Can I
there?
share?
Yeah, of
Yeah, the
course.
book.
Yeah.
Yeah, so here's
Yes.
the book. It's pre-orders right now, so we'll be in a couple of weeks. We'll be in all bookstores, and it's basically self-management. And my book has like a QR codes to my videos. So when a person is, let me show you here. So if a person is reading this page, for example, and they,
Oh. I got
So
you.
they want to watch me
Fantastic.
talking about this topic, so they can scan this QR code and watch. And I also, for example, this page here also has I asked them to write in a journal, and I also prepared a journal the journal is free for everybody who wants to purchases the book. So the journal is where they can write things, right?
Wow. Now I like that. That.
So if they send an email to my publisher, the publisher will send them a free PDF. They can print this at home and complete like the exercises in the journal, so they don't need to write on the book.
Tell me, whereabouts can they? Whereabouts is the book being sold? Is it being sold on Amazon?
Yes, Amazon and all in North America, Barnes and Noble, Indigo, but yeah, it's on Amazon. And so I just would like to show you this because this is self-management. So in my book, the cover is a mountain because I compare conquering your chronic pain to climbing a mountain.
Yeah.
So each person has your own mountain. For some people it's a higher mountain, for some it's a Everest mountain. But everybody has a mountain. So I compare like going up the mountain, it's a self-management. So all the steps that you need to get prepared. And I talk about sleep, nutrition, exercise, mind body connections. I talk about emotions. So all the things that you include in your pain toolkit, that is wonderful. And actually, Pete, you will be pleased to hear that in the resources page, when I say, here it's the end of the book, and I have a resources page here. I mentioned the pain toolkit for people to access and use it, because I do recommend to my patients, of course.
Have you got a website?
The website is www.drandreafurlan.com/book.
Okay, well, I'll tell you, if you can message me that, what I'm going to do
I will.
this afternoon, what I'll do on the links page on the Pain Toolkit website, I'll include that on there. Okay.
Thank you.
So that people who are watching the video can go and see the website, etc.
And on YouTube is just my name. If they go on YouTube, it's just Dr. Andrea Furlan.
Yeah, fantastic. Hey, listen, I know I've actually, I know it's your early morning now, and I don't want to cut into your day too much, but I think we should be doing some more videos together. I think because I've got
I think people like videos. And the other thing, Pete, I added each video that I post on YouTube, I add closed captions in 56 languages. So people, they tell me that they sometimes they don't understand English so well, but they read the closed captions. And so half of my videos, half of those 44 million views are watched with closed captions. So we need to increase accessibility to that information.
I think the healthcare people healthcare in general, sometimes they assume everybody is reads
fluent in English, but they're not.
I know. I think you're probably doing it, but on the website, I've a few years ago, I got a few years, only a couple of years ago, but I've got someone who's good at speaking. Not me. I don't think I'm a good speaker, but
like my mom and my dad, they speak Portuguese, so the only way for them to understand what I'm saying is with with the subtitles.
I think we need to think about people with persistent pain, who perhaps have a hearing impairment or visual impairment. So it's all those when I'm teaching healthcare professionals. It's about having the resources ready for the person that they're seeing, rather than just giving them a leaflet and stuff like that. Or I think it's important that they need to Andrew, how do you learn? You watch a listener, or by doing, or perhaps a combination, But that's where education comes in. But I think we'll talk about that on another video.
Yeah.
So, Andrew, thanks very much for joining me this afternoon.
Great pleasure talking to you again, Pete.
That's okay, and I'll see you again soon. Hey, everybody, thanks very much for watching. Hope you like the videos. If you've got something interesting to tell me about what you're doing in self-management land or pain self-management land, give me a call and we'll organise an in-conversational video. Again, thanks for Andrea. You have a pleasant day. Take care. Ciao.
Ciao.